So, good morning, ladies and gentlemen, dear friends, dear colleagues. It's symposium time. I'd like to cordially welcome you all to the 13th edition of the Lange Symposium, which is since in the second year in September, and from the climate change things is much warmer than in January. And I can promise you that you will have very nice weather conditions in these 2 days. So it will be very nice outside, but it will be interesting inside. So the program this year is dedicated to all the aspects of the modern management of right ventricular outflow tract. And we have esteemed and well-known speakers as experts in the field with our international and national faculty. And all they did come from as far as Toronto, Canada, Boston, United States, and from all over Europe as special guests and experts in the field to present specific aspects from different views on this topic. Together with our organization and scientific committee, Titus Kühne, Stefan Schubert, Stanislav Ofrutsky, Heike Schulz, Daniela Möske-Scholz, Sonja Wippeke, Daniela Lulo, and Friederike Zerbe, we planned the program, which is divided in 7 different chapters, as you can read in your program, in your folders. And it is dedicated to cover all aspects from the basic over interventional and surgical aspects to limitations, long-term management, and future aspects of the right ventricular outflow tract management. We will await 2 highlight lectures, one during the morning session and one as a very special warm-up tomorrow morning as the Sunday morning highlight lecture to get you all back in the audience room after hopefully a very crowdy and busy night in Berlin. Furthermore, we will hear 2 keynote lectures, and the first time, and I will address that later on a bit more in specific, the first time this year, the new Peter E. Lange lecture. The sessions, as always, should be very interactive and should give you all the opportunity to actively discuss with our experts, with our faculty during the Ask the Experts discussions rounds. Today, we will also find some time for recuperation with 2 coffee breaks and 1 lunch break. And after a long day, we have the specific get-together in the evening here at the venue site. Please find also the time to visit the industry exhibition, to meet their representatives and discuss also specific issues and specific aspects of your interests. As you may know, these kind of symposium may not be realizable without the substantial support of our partners from the industry. And thank you very much, especially to our platinum and gold sponsors and all the others highlighted in the program and in our breaking slides. Tomorrow, at the end of our symposium, we will have again a lottery drawing as the final step. And I have to highlight, all who will stay with us up to the very end may participate in the drawing, and the lucky winner will then have the opportunity to communicate and to talk to Alexa from the Amazon Echo. There is a free Wi-Fi available, and your access code you will find in the folder. The CME and EBAC certifications will be handed out tomorrow at the registration desk. If any one of you has specific questions or needs specific help or assistance, please do not hesitate to get in touch with our organization committee at the registration desk, and they will love to assist you in any aspects. I think now we are ready to start with the Peter E. Lange lecture as a new platform in our symposium. And let me allow to share our thoughts regarding this lecture. We decided to introduce the special Peter E. Lange lecture to honor colleagues who have acquired tremendous merits in the field of pediatric cardiology, who have made a significant contribution to the further development and increase of the knowledge in our world. This year, the first-time lecturer will be Professor Xiu Yen-ho. All of you may know her. Professor Xiu Yen-ho is consultant cardiac morphologist at the Royal Brompton Hospital in London. Her main interests are research and education in congenital heart disease and arrhythmias, including morphological correlates with cardiac imaging, surgery, interventions, and electrophysiology. She has pioneered numerous specialist short courses, including the renowned hands-on cardiac morphology for practitioners and allied health professionals. With her courses and lectures, and her highly sophisticated and intelligent way of demonstration of the disease-specific morphology, she had educated and trained so many, if not all of us, and therefore helped to understand the complex anatomy of the different congenital cardiac lesions as the basis to offer adequate treatment to our patients. She definitely deserves our thanks and respect and acknowledgement of her hard work over the so many years. It is a great honor and a great pleasure to ask Professor Xu Yen Ho to give the first Peter E. Lange lecture, Historical Evolution of Pathanatomical Knowledge about the right ventricular outflow tract. Thank you very much.